Welcome to episode 1 on series 2 of the Journey to Conscious Healthcare. This series is called From Burnout to Longevity, What Drives Allied Health Professionals and What Does the Future Hold? In this podcast, we explore what it takes to consciously create longevity, happiness and fulfillment in your life and that of others. The Journey to Conscious Healthcare looks at the healthcare industry, disability sector, and how to best navigate these areas to get the best for you and your life. I'm your host, Trevor Keane, and I'm the founder and CEO of Conscious Healthcare SA, an expert company that is known for high-quality healthcare services and transforming the healthcare industry in the disability space. Today's show is sponsored by Conscious Healthcare SA. At Conscious Healthcare SA, we provide high-quality NDIS healthcare services in the comfort of your own home. If you're interested in an easy and reliable way to navigate the NDIS and access healthcare services, please get in touch. Today's guest is the first Indigenous man to be elected as National President of the Australian Physiotherapy Association, APA for short. He graduated from the University of Sydney with a Bachelor of Applied Science covering physiotherapy before moving to northwest coast of Tasmania, where he is co-director of a multidisciplinary clinic. He has experience within the public, primary health and private practice settings, rural, Indigenous, aged care, and also occupational health sectors. Having held a number of leadership roles, his skills include having extensive knowledge and experience in policy, advocacy, and also political arena as well. He has held positions on the board of directors of the Division of General Practice Northwest in Tasmania, Tasmania's Medical Local Primary Health Care Strategic Advisory Council, and the Clinical Advisory Council of Primary Health Tasmania. Within the APA, he has held numerous positions including National Chair of the Business Group, Member of the National Advisory Committee, and also Branch Councillor of the Tasmania Branch, then Director now of the APA and Chair of the Insurance and Safety Committee as well. As the National President, Scott is looking forward to continuing the momentum of member, political, policy and advocacy engagement that has formed a significant part of the APA strategy. His passion for professional and the organisation will drive it forward to continue to put it at the forefront of politicians, funders and consumers' minds. To add to that, he's also the owner of Coastal Physiotherapy and a physiotherapist there too. Scott Willis, welcome and thank you for joining us from the APA and Coastal Physiotherapy.
No worries. Thank you very much, Trevor, and thank you for having me. It's quite an honour to do these podcasts with like-minded people.
Oh, fantastic. Well, I'd love to jump into a bit of your background. We always start with a little bit of a personal question. So the first one I've got for you today is in regards to where you're from and what it was like growing up. I hear it was an interesting story.
Yeah, look, I originate from the north, the western suburbs of New South Wales, or western suburbs of Sydney, and Mount Druitt, which is, if you Google Mount Druitt or look it up, it's quite a rough area of Sydney. So when I grew up in a working class family, went to public schools in primary and also high school. Went through that. I started to become a bit of a leader within that area, and started to think about what I was going to do when I left school, because in the western suburbs of Sydney, pretty much you didn't really start thinking about your schooling or what you were going to do until pretty much later on. And I decided to look at some healthcare. So I thought about nursing. I even thought about PE teaching. And then I decided to have a look at physiotherapy, because I actually hurt my knee. I did a lateral meniscus of my knee playing sport, which I played significant amounts when I was younger. And then I thought physiotherapy looks like a great career, because I had to have physio pre and post scope work. And I started to investigate it and got kindly told by one of my teachers that maybe you need to look at a different avenue of profession because one, I'm not smart enough, and two, that I was from the western suburbs of Sydney, and there's no way that I'd be able to finish a degree in anything. And put on top of that I was Indigenous as well, then I was being very, very foolish and should start looking at a different career. So if people that know me know that there's no way that that would stand up. So I became very committed and decided to take on the role of a physio, and got into Sydney Uni, which was Cumberland College of Health Sciences back then. Failed my first couple of subjects in first year, and thought maybe the school teacher was right, that I didn't have the capability or the capacity to complete the degree, but stuck it out and did a few changes in my life, and studied probably a bit harder and more determined, and graduated and thought, wow, let's have a look at a job. And there was hardly any jobs then. So then came to Tasmania for a new grade position at the Northwest Regional Hospital here in Burnie in Tasmania on the northwest coast. So that's how it all started, and progressed along from there.
That's an absolutely incredible story. And I was just thinking back to my journey. I had very similar experience. Got told, no, the ATAR or whatever it was at the day was too high. Maybe think of something else. And also I had a knee injury on my left knee. I don't know if yours was left or right, but I had a medial one rather than a lateral one. So I was resonating a lot as I was sort of hearing your journey, and wow, look at where you've sort of come to from there. So I think you talk about your journey. You've been told, hey, I can't sort of get there, and then look at you now. You're the APA president. Segueing into a little bit of Scott Boland being the second Indigenous, for those that are cricket fans, second Indigenous Australian to play cricket, and you're the first Indigenous person to be the APA president, from what I hear. Is that right?
Yes. The first APA Indigenous president, but also probably the first Indigenous president for a major peak medical body as well. So it's quite a significant feat, and one that I feel very honoured, and sometimes I reflect and think that I'm a bit of an imposter as well, because it's a big role, it's a big capability to or big shoes to fill, and fulfill the role to its absolute best. I feel so privileged and honoured to be part of that.
Oh, massively. I think you're doing a great job. You were telling me earlier about some of the videos that come out. I'm an APA member, so I get those circulated out, and obviously busy season, politics and all that sort of stuff coming up. We'll delve into that a little bit more, but I'm very intrigued. For those that don't really know much about physiotherapy, some do, but we are educating people along that journey. I would love, in your words, for you to just go a little bit through as what a physiotherapist is.
Yeah, look, I think a physiotherapist really specialises in, that real assessment and of movement patterns. The scope of physiotherapy has increased significantly and we look at right through the whole life cycle of the consumer, from, paediatrics right through to palliative care and everything in between, to, NDIS or aged care, to, workplace health, over to sports, to other areas of stroke rehab, to cardiothoracic. So you're looking at chest physiotherapy post-COVID in this environment. To movement patterns of people that are just really struggling in life, and giving them an opportunity or a solution and a management plan to move forward and actually get to their optimal point in what they want. So it's really consumer focused and wanting to get the best out of their life. So it might not be that they want to be pain free, but it might be that they just want to lift up their grandkids or go for a walk with their loved one for 15 minutes a day. Sometimes you're not going to fix everything, but you can make them to a point that their life is sustainable and that they're fulfilled to the maximum that they can.
Yeah, massively. I'm hearing a lot of independence is sort of coming through there. And what I'm not hearing in there, if correct me if I'm wrong, Scott, it's not massage, not just massage, because the amount of people I've spoken to, they're like, oh, hang on, I go to a physio for massage. There's a whole new world. You talk about the complexities in regards to movement and function and independence, and particularly a big focus in regards to exercising nowadays and the whole life. So many different spheres you can sort of be involved as a physiotherapist.
Yeah, definitely. I only just did a podcast late last year for a physio student in Melbourne that looked at the whole history of physiotherapy from 116 years ago to our current place, and it really made me investigate what physiotherapy, where it's come from, and it was the National Physical Therapy Association, or the National Massage Therapists Association, and then it delved into the Australian Physiotherapy Association. But that was our basis. That was our bread and butter, is massage, and that's what people thought that we do and still think that we do a lot of. And sometimes, I always say, sometimes you've got to do a little bit of massage to get them on board so that they actually do probably more best practice of what we see as our scope of practice now. It's just evolved over those 116 years, and I think it will evolve again over the next 116 years to be bigger, better, and even a larger scope of practice.
Oh, absolutely. I'm intrigued, and we'll absolutely delve right into that a little bit later on. But as far as what inspired you to become a physiotherapist, I know you said about having a knee injury there. I don't know if that was the inspiration or if there was more to it.
Yeah, it was more the knee injury, but I also played a lot of sport. Like, my wife often jokes about a different sport in, say, the Olympics will come in and say, oh, have you played that one? I go, of course I have. Have you done this one? Of course I have. I've played. I don't think I can ever remember a weekend that I wasn't playing a sport, or a night that I wasn't going to training or something like that while I was growing up. So sport was a big focus, and you put sport and physio together, and that was my biggest aim, was to be the Australian physiotherapist for the cricket side. Or then the soccer side. I did some physiotherapy for one of the semi-professional soccer sides in Sydney. So that was my next goal before moving to Tassie. So I think that was my biggest inspiration. Sport and work would marry together, would be my optimal dream, and it's come a whole 360 degrees, I suppose, in seeing that now.
Oh, that's incredible. The rigors of professional sport are really challenging, and it sort of segues quite nicely into one of the questions that I've got down here, which is, how do we, say with new graduates, the expectations against reality, everyone tends to want to be a sports physio. It's not everyone, but it's pretty high, right? So how do we have new graduates manage their expectations versus reality? Because everyone does want to be, say, a sports physio. What do we sort of do to make sure that those coming into the profession do get realistic? I mean, I've been in professional sport myself. It took me overseas into England to be able to do that as a physio in cricket. But fundamentally, there's not enough roles for everyone. You think of the Saka physio being there for many, many years. Those roles don't turn over too often. So how do we manage the expectations versus reality when you're coming into the profession?
Yeah, I think it's a good question, because I was exactly the same. I was going to do just sports physio, and that's it. That's all I wanted to do. But then I think once you have a look at the whole scope, come out into the workforce and actually have a look at some of the opportunities and some of the areas that are underdeveloped, and some of the areas that you actually start finding yourself navigating through. It's like any profession. I think you have an expectation, but once you get on the ground and start using your skill, you start to realise that there's more to that than just, say, for us, sports. And I was exactly the same. I came came down to Tassie and thought sports is all I wanted to do. Got into orthopedics and chest physio, ICU, outpatients. I was doing everything, but I just got a grasp that that I really loved that teamwork. I was a sports person. I love teamwork. So orthopedics just ticked that box. I couldn't do a lot of sports stuff because it was all out of hours and it wasn't going to pay the bills. So I was looking at other areas, and orthopedics was a huge team player on the wards, post-op, pre-op, all that, and then went into a private practice and thought, okay, I'm going to go out of the public system and start looking at what was really required in private practice. And I thought, I just can remember a GP I worked very closely with said, I want you to come to the local pulp mill and I want you to start redesigning their whole processes, and I want you to redesign their pre-employments. I want you to redesign how we can reduce their injury rate. And I'm there going, I've got no idea what you're talking about. Like, I've never done this before. And he said to me, he goes, Scott, you've got the skill set to do it. Look at it from a different angle. He said, you've played sport. You've done orthopedics, you've done, all the different aspects of it. Use your skills in a different way and come out and have a look, and you'll be amazed at what you find. And I go, okay, rightio, no worries. If they were willing to pay for me to come out and do this. And when I went out there, it was a light bulb moment. I'm there going, I have the skills of, I can look at every movement pattern. I can have a look at the injury recognition. I can have a look at how we're going to prevent this. If it happens, how we treat it. Can we assess it to make sure that it doesn't keep happening? What processes can we put in place to actually stop that? What are some of the things externally that these guys are older, they're an aging workforce, they're overweight. How can we assist in keeping them at work longer and safer? So I started to think, and I thought, this, one, teamwork again. Two, I'm using my skills just like a sporting field. If you had an injured athlete, you'd be there going, how are we going to, one, stop it from happening again? Two, treat them and get them fitter and ready to get back into the work. So I think once you start thinking about things differently, it will open up your whole mind for the full scope of practice of physiotherapy.
Well, I think that's a very fascinating answer. And what I'm really hearing in there, I've done a fraction of the occupational health as well at a previous organisation, but it's very much almost a bit of an OT lens that gets applied there. You weren't just talking about physical movements. It was very much about what are these other factors that actually influence, your mental state of mind that you sort of rock up in, how the different functions are, what people's capacity is, lots of different things can influence. And it sounds like you're very much upskilled throughout that role, and it opened your perspective to be able to see things newly. And it sounds like you really embrace that challenge.
Yeah, and look, and that's one of my biggest roles I do now is occupational health now. It's one of my passions, is because I can see the role that we can play and the skill set that we've got, and the opportunity that we can project into the workforce, but also into the community, and the actual positive effect you can have onto the local community, which is significant.
Oh, that's amazing. You sound like a very passionate person, that's for sure. Whilst we talk about passion and things that drive people, I'd love to know, in your experience, what is it, the drivers behind physiotherapists and what they want to do? What do you reckon?
Yeah, I think as physiotherapists, we're always care for people. We've got that caring nature, probably too much at times. It can be a negative as well as a positive, but I think we always care for our patients and always want to help people, always looking for that next thing to help them with. So we're always that helping. I think that's number one. I think we always want to continually learn. We're always searching for new ideas. We're always searching for new research. Always searching for new techniques, or how we can actually help our patients with whatever area that we're in. And I think we're in a unique way that we are so professional as well. Probably, again, it can be a negative. We're too professional or too ethical at times. You look at other professions that probably aren't as ethical. But I think for us, and I hope we don't lose that ethical feel or that ethical approach, but it can be a negative in a really tight economy or a tight health system, because if it's not best practice, we don't want to do it. Where sometimes you've got to do some low value care to get the patient to do their high value care. But I think we also want to be valued by our community or our mob in some way. So I think our drivers is that if we can value add to the community or value add to our patient mix, then that's a very, very big driver. And then the last one, I think, is caseload. I think our caseload, our driver is that we want to be stimulated constantly. I think one of the biggest things is if you get stale, if you stay in one area for too long, then you get disillusioned, and that's when we start losing some people. So I think that variety of caseload sometimes, or variety of different patients is quite a big driver behind us as physiotherapists as well.
Oh, I can totally hear that. So a lot of diversity in the way that the type of patients that you sort of deal with. So then you can get that sort of very much problem-solving brain going. So how you can sort of assess the function and then see, hey, how can I actually get this person moving a bit better? Or what are the real barriers? It might be that you're delivering A plus physiotherapy, but that person's just not in the right mental state or something else like that. So as you're sort of saying, you don't always go to where it looks like the problem is. It can sometimes be covering things up. So yeah. Sounds very relevant there. I'm quite intrigued then, as far as with your journey, you've had some influential people along the way. I'd love for you to just mention a few of those and what sort of experiences or advice that they might well have given you.
Yeah, look, I think me coming into a leadership role, especially, I think it's quite pertinent that the past president of the APA, Phil Calvert, who's a very close friend now, has really set the bar quite high, but also gave me the passion to actually continue on my own leadership path, but also identified what my qualities are that I didn't actually know. No, if you would have asked me, say 2 years ago, whether I'd be the next APA president, I would have thought you were on drugs or something like that. But he was one that really inspired me to take that next level. And I kept on saying, I'm not really ready for it. He said, no one's ready for it. You need to go into it, and you will make it your own. You will grow. You will become a leader at that next level. And I think the profession needs someone like you at this stage. He said, because I kept on saying, oh, maybe down the track I can do that. And he said, it might not be your turn. The profession might not need you at that time. At the moment, they need you now. So I think, he's been a huge influence on me. The past president of the APA, Chris Massis, was a very huge influencer on me to delve into the Australian Physiotherapy Association and what I could give back to the profession, and then through to our current CEO and Anya Nikolic, and our current board chair, Jenny Aiken, who really, the three of us have really got a good teamwork. It comes back to teamwork again, where I love, and the leadership roles that we've formed has really taken that the association to that next level, because we understand each other, we work well together, but we've also got a great team underneath us of all the staff and the executive team of the APA. But it's that teamwork. And then if you looked at my Indigenous background, I think if you have a look at Marilyn Morgan, who was one of the first Indigenous physiotherapists that I have so much respect for, because she did it tough early and has done all the tough, hard yards, and I've just come along now and like on the back of Marilyn, who's done enormous work to actually delve physiotherapy into the Indigenous health arena. So I think looking at her, it's inspired me to continue to push forwards in a leadership role, but also how Indigenous health can be improved by closing the gap in terms of reconciliation, and what are some of the barriers, but also I think what are the opportunities. And that's one of my biggest goals, being president of the APA and the first Indigenous person, would be to I want to leave a legacy that that physiotherapy is culturally safe, but also culturally brave, to be able to to advance Indigenous health within Australia and internationally as well. So I think they're the types of people that really inspired me to especially in this new leadership role that I've taken on.
Well, it's you're sounding very youthful and inspired and passionate. I think it just wants people to jump out of bed and sort of get on the bandwagon that you're on there. Whilst you're talking about Indigenous health, would you like to sort of open up that topic? Because I know it's a pet passion of yours. It's something that you really want to drive forward. I'd love to sort of delve into some of those topics and sort of discuss that a bit more.
Yeah, look, definitely. I always come back to it's a journey for everyone. Everyone starts at a different point of this journey, gets off the train, gets back on the train. Not everyone's at the same point. So I think that's where everyone gets a bit frustrated with reconciliation, where, I might be, higher up in my journey where someone's a little bit lower and they expect to be at that level the same as me. But I think it's that personal journey. And for me, personally, I didn't identify overtly when I was growing up in the western suburbs of Sydney because I would be criticised. I'd be pretty much bashed. I would be victimised and things like that. So I was always kept quiet. The APA has given me, and the physiotherapy profession's given me an opportunity to find my own heritage, my own journey in reconciliation personally and professionally, but also it's given me the opportunity to assist other people in their journey in reconciliation, and that's where the Australian Physiotherapy Association has been so proactive and so far along that journey that we are true leaders internationally, but also domestically within healthcare for reconciliation in terms of really being and pushing culturally safety, but also cultural bravery as well. So going above just being safe and being respectful, understanding the wrongs of our past, and ensuring that we don't go back there, that it's embedded within the profession, embedded in the organisation, that it will really set up for the rest of my life, but also hopefully the generations to come, to understand where we've come from, where we want to get to, and how we're going to get there.
Yeah, well, I'm really hearing a different lens, if I dare say it. You talk about it being embedded, having a lens that comes on and you just are aware of it, because I think there's a lot of ignorance that can sort of be around, and cultural safety is very important in a country like Australia where you've got so many different cultures around, and to be aware of all that and constantly learning and growing and developing. And I mean, you work in the disability sector and often you see people, you have participants, so NDIS participants, so people that are getting serviced as such or getting service, but then you might be talking to a support worker, like just being a bit more sensitive in regards to actually talking to the person. They are a person and engaging with them. Have you got any sort of words or advice in regards to with the Indigenous community, or even just broadly speaking, talking about cultural safety and inclusiveness? Any tips or tricks?
Yeah, look, I always say trying to delve into your local community. So I always try and encourage people to make contact with their local Aboriginal health service. By just emailing, ringing them up. I can remember Phil Calvert rang me one day and said, I can always remember, Scott, you saying you should contact your local Aboriginal health service. He said, I did. He's a paediatric physiotherapy and his practice is what he does. And he said, I rang them up and they go, we've been waiting for someone like you to come along and we'd love to partner with you and get you to provide this service and that service with our Indigenous mums and their babies. And he's formed a great relationship. And it's really got him involved and understanding of the local Indigenous people, and then trying to go and do some Indigenous works or Indigenous walks, go and look at their art, go and look at some of their, their medicines, just go and do anything of culturally offerings that they're doing within your local area, and have a look and just participate, because you'll open your eyes of why people are so, they are so sensitive about it, and how you can change just some of your language, even simple things like putting an Aboriginal or a Torres Strait Islander flag at your reception, a welcoming sign of their local community, their local mob. to your practice. Making that culturally sensitive approach to them. Just trying to embed your own personable practice or deliverables into that community. It just makes a huge difference, and I think it makes you open your eyes a little bit more and delve a little bit more into the past, what's happened, and how we can make it a better place for all Australians.
Oh, that's amazing. It's very practical tips. I think sometimes you can talk about topics and they can feel like you've had some good insights and ideas, but then actually applying it. So it sounds like a great idea to then reach out and connect with your local health service in the Indigenous sort of space. And as you said, immersing yourself in the culture. I love some of the paintings that are around there, the paintings, and it's amazing when you go and see all the different artworks and the cultural experiences that you can have. Very rich, certainly richer than what I've probably seen. I really enjoyed having a look at some of those myself. Our next question, as we sort of go into, I'm going to make you a little bit younger here, not much, only a couple of years, but what advice would you give to your 20-year-old self? Amazingly, you've somehow graduated at 20 years of age. What sort of advice would you give to yourself as a new grad at 20?
I think as a new grad at 20 is open your eyes, keep your mind open. Don't just get focused on sports physio or one particular area. Don't think you need to go through the public system as a new graduate as well, because I think that's the biggest area when I graduated, when I was 20 or 21, that you had to go through the public system to get your grounding before going into other areas that you wanted to look at. I think that's completely changed. Private practice is better adaptive to new graduates. Again, you still got to pick the private practice to go into. Not all private practices would be ideal for new graduates, but it's improving. They're actually starting to take notice and the opportunities that it can deliver on taking new graduates, and some of the opportunities it gives the practice to re-stimulate, to learn new things, but also to bring energy to the clinic as well. So I think keep your eyes open. Don't just look at the public system. Keep the passion, I think, as well, and keep learning. I often say, people say, "Oh, you'd know it all by now," and I go, "I learn something every day from a patient. I don't think there's a day that I can think that I haven't thought, never thought about it that way, or that responded completely different to how I thought it would be. I can't believe that worked. I can't believe that didn't work." And you start that reflective, I think, reasoning quite a lot, or that delving into why it didn't work, why it worked, and it's that constant learning. I think if you lose that, it's time to give the profession away.
Yeah, I can hear you with that. I think it's very important for you to stay stimulated, and it's all contextual as well, isn't it? You have 100 people and you do the same treatment. 100 people, they could have the exact same knee or back or whatever else it is, but it's always going to show up differently because of how sensitive people are, and not in regards to their feelings, but like they might have a stronger sensation towards pain, or they might have different contextual experiences, work, whatever else it might be. I think that's very important.
And I think too that don't think it's clinical. Don't think it's clinical that's going to make them better as well. I often talk about the soft skills or the non-clinical skills. If you're very connected with your patient, and they understand you, or they understand their condition, and they got a path to move forwards, and they like you, and you're nice to them, they'll get better. You'll get a better outcome, and you'll feel better as well at the end of the day.
I can completely agree with that from an experience working in return to work. Workplace injuries and all that sort of stuff. A lot of the time a patient will just want to literally be heard. They want to be heard. They want to be understood. They want to understand that, hey, you get it. You might not know exactly what that feels like, but you understand what they're going through, and you're sitting alongside them, not the whole, you're sitting there and poking a finger or anything else like that. You actually really get that experience, and you're working with them on that journey. Ari, one of our practitioners, has sent through a bit of a question, which I'm intrigued. So he goes, what bit of advice would you give to a student on maximising their financial potential once they're qualified? Is there any unsaturated specialist fields that you would recommend?
Look, I would. One of the most emerging areas of physiotherapy that's underdone, that is, I think, is going to be the biggest thing in the next 5 years, if we do it right, is women's and men's pelvic health. I think if there is one area that we can assist, the research backs it up. The economic value physiotherapy report that we provided early last year demonstrated it was one of the most economically viable, economically positive investment that any funder or any consumer could do with the most optimal outcomes would be women's and men's pelvic health. That would be my biggest thing if you wanted to get into an area that would be an untapped market. That's an area that I think would be an amazing area to go into, because there's so much scope to go into.
Oh, absolutely. Sounds like a really good entry. Whilst, opportunity for someone to sort of delve into. Scott, one of our other practitioners, has sent through. So both of these being physios, one's a student and one's qualified already. So as an industry, so this goes through a little bit about evidence practice. So what are we doing as an industry to ensure that we continue to meet the high standards in regards to evidence-based practice and remain respected as a profession? He's got an experience here. His experience has been that many private organisations might look to the financial side of things and prioritise that a little bit too much over what is best practice. He doesn't think it's sustainable. What are your sort of thoughts on this?
Yeah, look, one, I think from a whole profession point of view, I think if you look at the Physiotherapy Journal, it's ranked number one in the world. It's way above any other journal in the world. So from a profession point of view, I think we're actually developing and producing the best research in the world. I might be a little bit biased, but if you have a look at the statistics, it is by far the journal of physiotherapy worldwide. Secondly, I think we need to be able then to, how do we take that research and put it into practice, and that bring it into practice is the next level that we need to improve on. And from the APA point of view, we're doing that quite significant investment in trying to bring the research and how we can translate that into clinical practice. The third thing I think in that is that I think the consumer is so much more aware, and we've got Dr. Google and internet now. Any practice that does not provide a sound clinical best practice care will not survive. I think gone are the days where I've heard in past years that someone might be seen 5 times a week for 10 minutes of ultrasound and a little bit of a massage, and seen again tomorrow, and then again tomorrow, and then again tomorrow. I don't think those practices would survive these days, because the consumer is so much more aware of outcomes, and that's not best practice. And I think the funder has got so many more systems in place that they will pick up the outliers and run them out of business anyway.
And are you pretty confident I think you're completely correct on that. From a private standpoint, are you pretty confident that that'll have the same way as well? As in an insurance scheme, I suppose you've got more safeguards and measures, whereas I suppose, you only know the backyard that you're in, right? You think your backyard's great or your house is amazing, and then you go to your friend's house and you're like, wow, this is pretty special. So what about the privately funded patients, so those that fund themselves? Do you reckon that they sort of will cotton on to that?
Definitely. I think they'll be the number one that will cotton on and go, I'm not getting anywhere. I'm not improving. I'm going to go to the guy down the road, and if he's no better, I'll go down to the lady down the other road until I get, one, what I want, the consumer-based program, 2, some outcome measures, and 3, I'm treated with respect and nicely.
Yeah, no, I think that's really, really sound points you make there. As we sort of venture through, I'm very interested. So I don't know if my stats are quite right, but it was a little while back. The average career was around 7 years for physio. It might not quite be right anymore. But how can we prevent burnout in physiotherapy? So it's obviously too short. I've studied 5 years to get a master's degree in physio. How can we prevent burnout?
Yeah, look, it's the number one question for early entry and mid entry physiotherapists, and the APA is really working and working really hard and investing a significant amount of resources in this area. I think one of the biggest things is to have a look at our career pathway. I think our career pathways have been a little bit, you do a bit of this, do a bit of that. If you want to do sports, go this way. If you want to do this, go that way. Well, I think now what we're looking at is trying to develop different career pathways from new graduate to specialisation. So if you wanted to be a specialist sports and exercise physiotherapist, this is the pathway you want to go. If you want to be a generalist, like someone like myself who wants to be a generalist because I'm in a rural area, you've got that pathway where you can go, I might do a bit of that, I might do a bit of this, I need a bit of that, I need a bit of that. My community has got a high rate of this, so I need that as well. So you can actually, come in and out of the different streams within that career pathway as well. And I think as well, sometimes we need to continually stimulate ourselves. And I think that's where, from a pathway point of view, there's more and more opportunity to actually delve into different scopes of practice of physiotherapy. So if you do get a bit stale, a little bit bored in one area, I think, you'll have opportunity to have a look at different areas as well. I think the pay structures have got to be sustainable as well. And I think, as new graduates, I think sometimes we do have a little bit of unrealistic expectations that we're going to have a significant pay when we first come out, especially if you're going into, say, a private setting. So I think we need to look at how we remunerate our new graduates from coming out and then and how it moves into the mid-level. And I think even in the public system as well is how, as you do your master's degree, as you do your specialisation, how are you recognised in the public system? You might be doing your master's and you might be doing your specialisation, but you're still at a lower level because there's no career advancement in that area. So the APA is really looking at how we can integrate the career pathway within the public system as well as the private system as well. So I think the career pathway is a big one. The pay structures is the second. I think also that regulation and paperwork doesn't overtake our decision making and also our ability to treat and treat to our full scope of practice as well. So if you have a look at, say, aged care, at the moment, the current structures of payment for services is really low value care or that low value. So one way of reducing the burnout in that area is increasing the full scope of practice that a physiotherapist has and opening up the actual funding for that as well, which hopefully the new funding model might do. That we're really pushing the government on that to help with that as well. So I think the full scope of practice, stop over regulating, stop having us to justify everything that we do, and remove some of the barriers of our job as well. So some of the barriers of healthcare, such as referral to specialists, to referrals to imaging or looking at prescribing and things like that. So really opening up our full scope and stop putting some restrictions on us. I think that will really also reduce our burnout rates in that mid 7 to 10 year cycle of physiotherapists.
Yeah, that's a very well thought through answer. I'm quite intrigued. There's a lot of different facets to open up there. You talk about pay, and then so you've got an example where you've got a, say, a new therapist, they want to be on 60 grand or whatever else it might be, 60, 65 grand. But then at the same time, like as a business, you've still got to function, right? There's a lot to be said in regards to the work that goes together to make sure you've got a caseload. Someone can walk in and actually have that work. So someone wants the pay of someone on 60 or 65, and then there's a responsibility of certain billable hours, or it might be in regards to making sure, what are the things that have someone return within, still providing best evidence-based practice, not just getting them to come back those 5 times doing ultrasound. Gone are the days of any of that. But like as in, very interesting if you look at it from a clinic side of view, and then also the therapist, because I think that maybe there's a lack of potentially insight as far as, like as in, it's all for, if you want a learning playground, that's fine. But like as in, some of that learning's, I suppose, on your time versus on the employer's time. And it's a really challenging one, because fundamentally we want to have people supported, but we are in a business model, right? People still need to put bread on the table and still need to be able to look up. I don't know if you've got any immediate thoughts on that, because that's a whole conversation, isn't it?
It is. Part of my role as the national chair of the business group was to really push the button on this one, and so it was. It's a real good passion for mine. Look, I think there's a mismatch between new graduates coming out and the business owner, where I think that's where it's got to be an understanding between the new graduates and the business owner. I always say that as a business owner, if I employ a new graduate, I'm not going to make any money out of a new graduate probably for 2 years, because they're not going to be billing at a rate that's going to make any money. So I try and invest and recommend people invest time into their new graduates to bring them up to speed a little bit quicker, and also give them that support to bring them through so that they do feel comfortable in increasing their billable hours in a safe environment that actually is effective, efficient, and not too threatening, because I think sometimes that's where they burn out as well, is that they're expected to see a patient every 15 minutes so that they actually make the practice some money. It's unrealistic. They're not going to last. So I always come to the realization that at least for the first year, but possibly the second year, depending on the therapist, you're not going to make any money out of them. But if you invest some time and energy into them in that first year, they will repay it down the track. If you just put them in a room and tell them to treat, they're going to leave within a year to 2 years. Especially in the current market, the current market is that every man and his dog is looking for physios. The supply is not there, and they will move to someone that's going to pay them more, maybe look after them more. And the current generation is completely different how I looked at things. Like, I never had annual leave. I never had sick leave. When I went into private practice, it was virtually a percentage of what I brought in is what I got paid. If I didn't turn up to work, I didn't get paid. If I had a holiday, I didn't get paid. It's completely different now with the national employment standards. But I think you just need to put time and energy into your new grads, and hopefully it will repay it down the track and keep them in your practice and within the profession as well.
Yeah, I think that's a great answer once again. I'm even intrigued as well. I've thought about this myself as far as the rates in which some charge, say for, appointments often are 15, 20 minutes, and it might be somewhere between $50 to $80. I mean, sooner have a 30-minute appointment for $150. And actually, if you think about meaningful outcomes, right, seeing someone actually be able to assess, then get them back. I mean, because ultimately it's all about how can you then get someone on board in that time, also then have them maybe follow through on some of their own exercises that then provides more value. Because you've got to understand where the value is at. So, like, as I personally think from a financial standpoint that the cost could actually even be high. You could have 30 minutes for $150, or I don't know, 40 minutes, whatever it is. But just in regards to having that time, because what you can deliver in that time can be far greater. But then it's also like, well, if I'm paying $150 here where I can get $70 or $80 up the road, but it's that demonstrating that value. Because I've seen other models. There's a guy called Paul Goff over in the UK who very much sort of moves on a different model. I don't know if you've sort of heard of him or got any immediate thoughts on that at all.
Yeah, look, and I think you're spot on. It's the value. It's the perceived value. And I always tell our new grads, it's the value that the consumer puts on your time. If they don't perceive the value, they won't come back. They'll go down to the down the road to the next physio, or they'll want to see someone else. So if you're nice to them, if you provide a quality service, listen to what they want as well. Okay, you might think it's completely different, but you might need to do a little bit of massage to get them to be on board, so that they actually feel value, or they feel the value in you to want to come back or follow your treatment plan that you've just set up to best practice, but they still want that low value care first to get to that high value. So if you don't listen to the consumer, you're going to lose the consumer, and you're not going to be an effective therapist.
I think you're very clear on that. I think very much consumer focused, and I think that's the way the world's going, to be fair. On that note, I think we probably have covered this question a bit, but
I always say that we're in a service-based industry now, not a health-based industry. That's my biggest thing now. We can't think that we're a health industry. I think we're a service-based industry now, and until we get our head around that and actually listen to the consumer and what they want, that's where I think we need to change our mindset a little bit. Is that we are in in that service industry rather than a health industry.
Yeah, that makes sense. That makes a lot of sense, actually. I'm sure we'll unpack that maybe a bit later on. We sort of covered this a bit, but I'm intrigued as far as answer the question about burnout, and we sort of answered it a bit, but I'm intrigued as far as how do we create longevity, happiness, and careers that fulfill practitioners like physiotherapists. You sort of said about a career pathway, practically on the ground, someone in the clinic. I mean, is it reinforcements, or what things are there? I know we've breached into this, but is there any more gold that's in there, you reckon? Can we squeeze the orange for a little bit more juicy stuff?
Yeah, look, I think it's like anything in life. I think you've got to be happy where you are. Say from a board point of view, I could apply for every board in Australia, but if I don't have the passion, if I don't feel like the board culture is within my culture, it's not going to work. If I go and work for Trevor Physiotherapy, your culture might not fit my culture. So it's going to be a mismatch there, and it's not going to work. So I think not every practice is for you, not every department is for you. I've seen physios go from different departments, different practices, and they can't find a home until they get to one, and they go, I'm home. This is the type. This is the culture that I like within my practice, and I really like the people. I really like the systems in place. I really like the consumer. I like the processes. I like how they do things within the practice. So I think you need to be able to fit into the culture. And now when I interview someone, I don't go on their clinical attributes anymore. I go on what their personality's like, if they fit in within our culture, and because they're usually coming to a rural area in Tassie. I've turned away quite a few physios because I just don't think they'd fit into our culture. I don't think that they would survive. They might last 6 months, and I go, look, you're not for us. I think would love to have you. Your skill sets are great. But you will not fit into our culture. So I think for any new graduate or mid-level, you need to fit into a culture that's right for you. Because if you don't, you're not going to survive there. And it might be that they have a cake every week. It might be that they provide lunch every day. It might be that they provide PD, that they provide something. But you need to make sure that it's what you want and what you think that it's going to help you in the long term as a clinician.
Well, you raise some extremely valid points there. Do the practitioners themselves know that?
I don't think so. Yeah, I think sometimes, say when you get interviewed, it's me interviewing you, but the clinician doesn't ask enough questions of us, the practice owner. I'd be if I was going for a job now, I'd be asking the practice owner. They're going, so take me through a daily routine. Take me through what's your PD like. What do you do? How do you? What happens if I don't like some of the processes you've got in place. What do you do on birthdays? Do you all get together on weekends? Do you, find something that you want in your employer? And if they don't do it, then I wouldn't accept the job if it's offered to you. So I think you've got to actually investigate. And a lot of people don't even look at the website of the job that they go to. I always ask,
understand the values.
I ask them, I say, tell me a little bit about what you know about us. And if they don't know anything about me, I go, you're not really interested. If you haven't done any homework on our practice, if you don't know how many staff work here or what locations we're in, I don't think you're just wanting a job out of anything. You're not actually wanting to come here because of a reason.
It sounds a little bit like playing darts with your eyes closed, right?
Very much so. Yeah, that's why you've got to ask a lot of questions.
I think that's fantastic. You've given some great advice there as far as what therapists can do to make sure that they actually find themselves. I'm hearing really belonging. You want to place, culture, but like with that is, having a sense of belonging and purpose as well. I mean, there's a guy called Daniel Pink. He talks about autonomy, mastery, and purpose. They're the three psychological nutrients that anyone really needs to sort of thrive. And really, by making sure you've got a sense of belonging, those other sort of things, you feel safe to raise concerns, and you just feel like you're part of whether it be a family or just a great community. I think that's really important. On the flip side of that, though, so COVID's come up, telehealth, quite an interesting one. To being comfortable, to not being comfortable, I'm interested. You've done quite a lot of telehealth. I'd love you to just absolutely paint a picture here and tell us more about what's involved, telehealth, and how to go about it.
Yeah, look, it's an interesting journey, old telehealth. I can remember probably 7 or 8 years ago being the national chair of the business group, the APA. I was summoned to a meeting with all the big private health insurers in Sydney, so I had to fly from Burnie early in the morning and get to Sydney at lunchtime for a meeting of, I think there was about 15 of the big private health insurers there. Walking into their boardroom with Phil Calvert, the president at the time, and Ian Watts, who was the GM of our policy team, and what they wanted was give us a rundown of telehealth. We've heard about this telehealth. Give us a rundown how it's going to work. What are the guidelines? What are the governance structures around it? And we said, yep. So we went through everything. Like, we had a huge document. We had PowerPoint presentations. We thought, yep, we've got this. We've got this. Yep, no worries. So we got there and we started going through the PowerPoint, and one of the insurers just absolutely berated us. Didn't want to have a bar of it, thought that the physiotherapist would just rip the system off. They would have 14 screens and 14 different people going on at once and claim for a 505, an individual session, and it would be just a money-making venture. See you later, get out the door. We don't want to talk to you about this anymore. So that was about 7 or 8 years ago. We walked out of there deflated, quite annoyed that the decision was made even before we got there. It was quite evident. Anyway, going out of the door, one of the private health insurers said, you're well before your time. This is going to get up. Just give it time. Just go away and do your homework a little bit more. Come back with a bit more governance. They gave us a little bit of instruction on what they thought would be good. Then comes along COVID, and COVID comes along, and patients can't come in for treatment. They're still paying their premiums. How are we going to get their treatments and their continuity? But also, what happens if they can't get treatment and we'd have to reduce their premiums or something like that, will we? So there's an appetite now. So there's an appetite for the insurers, but also then the government to go, we need to look at this seriously. And we had everything already. It was the governance structures, the documentation, how it was going to work, what systems you needed to have in place, the legalities. Everything was done. Within 6 weeks, it was implemented.
Wow. And I think that goes to show a lot about how the APA has been a bit of a front runner in that regard to make sure that they're really aware of what's happening and where the future's lying. As far as we're continuing to talk about not just telehealth, but the future of physiotherapy, what does that look like as far as, let's just go short term because I've got a special one for you later, but moving into the future, where are we sort of going? And maybe I'll have a bit of a prelude. So we've got exercise physiologists that are increasing their scopes, which are coming into the edge of where traditional physiotherapy is laid. And then we've also got functional capacity evaluations that are getting done by OTs left, right and centre, a lot of paediatric work. So I suppose what I'm opening up is the field of occupational therapy, exercise physiology, and then we've also got developmental education. I mean, where does physiotherapy fit in that, and what may it look like into the future?
Yeah, great question. And this is one reason why the APA actually developed the document of the economic value of physiotherapy. There's been no document ever produced by anyone that actually demonstrates the beneficial impact of, say, all your research and that. So all your research is all out there saying that physiotherapy, if you follow this, this and this, the consumer will get better. And it's much better than everything else. But there's been no economic value behind anything of that. So we've actually delved into not just the research behind it, but also the life expectancy, the quality of life improvements, and then the actual economic improvement or the economic efficiencies with it as well. So what you put in and what you get out. And this was one of the biggest reasons behind it, is that we've got such an increasing, I suppose, competition coming in. So we need to be able to demonstrate that we can do this better, cheaper, and more effective and more efficient than our competitors. So if we look at, say, occupational therapy or EP, we can demonstrate that if physiotherapy provides this service, then this is what it will cost, and this is what the benefit will gain out of it compared to other treatment modalities as well. We presented this to Minister Hunt only about 4 months ago, and his first I was briefed to go to the meeting with Minister Hunt to sell this to him. I think I was 30 seconds in. He said, "Yep, you've done it, Scott. What next?" He could see that the economics was there, the research was there, the quality of life was there. So I think we really need to demonstrate that. On the ground, though, I think we need to back ourselves, but we need to actually provide the service. If we don't provide the service, other professions will come in and do it for us. So that's where bringing out physiotherapists into rural and metropolitan areas that are in a need, into aged care, into NDIS. If we don't, other professions will pick up that gap and push us out.
Yeah, it's quite fascinating. It sounds like obviously very much a lot of economic value that's been demonstrated, but I'm really curious as far as, say, you said that you do a bit of NDIS work in your practice, and I'm sure you're in touch with many other people that are involved in the sector. OTs or occupational therapists are everywhere in the sector, and capacity, I just find it fascinating. I talk to support coordinators regularly, and when talking to them, they're always like, yeah, I need an occupational therapist. And I'm just intrigued. So there's all these physios that we've got around that have got capacity that I believe probably could do some of these assessments, albeit that, we're covered by Pearson's in regards to being able to do level B training. If you go on there, you can have a look at certain assessments that you can do. And I'm like, well, is that something that physio should be? If we've got capacity to do it, then is that something physiotherapists should be doing, these assessments? Because I know in the NDIS, there's a lot of occupational therapists that are actually in the behind the scene. And so because they're behind the scenes, obviously that's sort of where you're coming, a lot of this stuff coming through, because it's coming from a lens which is occupational therapy, rather than how can we best serve a person? How can they get a service now? I don't think sitting on a wait list for 6 or 9 months is doing them any good. Just to wait to get a perfect occupational therapist. Now, there's absolutely huge space. We've got a team of occupational therapists ourselves. But I suppose over to you, as where do you see physiotherapy lying?
Yeah,
in that
definitely.
space?
I think the consumer needs to be aware of our scope of practice. I just don't think that they're aware that physiotherapists. If I said to if I said to 10 of my mates, I'm going to go and see an NDIS patient, they go, "What are you going to massage them? What are you going to do to them? What on earth would you be able to provide them?" Once you then delve down and go, "Well, I can do this, this, and this," and they go, "Oh, I didn't know that." They would not have a clue. And then if you have a look, and this is my biggest beef with NDIS, is if you have a look at the assessors, you have a look at the case managers, they're not medically trained. They've got no idea. I wouldn't say no idea. They've got minimal knowledge of the different scopes of practice of all the different professions. They haven't probably dealt with physiotherapists at that level for either ever or for a long time. And a lot of physios think it's too hard to go into that area, so they shy away from it. The APA's just had a grant and produced some videos and that, trying to encourage physiotherapists to come into the disability sector and try and debunk the myths of it's too hard or we haven't got the skill set and things like that. So, us as a profession, us as an organisation, is trying to reduce the barriers and encourage people to go out and do it. Then you put on top of that the regulations and things like that, and the paperwork and things. I think a lot of physiotherapists just hear about that and shy away from it. So that's another barrier that a lot of physiotherapy practices put up as well.
Yeah, I can understand that. It is a challenge. There's a lot of paper and report writing that goes on with it. I think fundamentally it's just a bit of a shame that there's such a need and it's just not getting met. To come to that time, Scott, our final question. So, Scott, let's pretend you've had a child right now. Well, not you, maybe your significant other. It turns out that they're going to be a physiotherapist. What does the next generation of physiotherapy look like? Just so happens that your child's going to be a physio.
I think it's an exciting time. I think, especially, the next 20 years, I think it's going to be a very, very exciting time for healthcare, but also for physiotherapy specifically. I think, the time for reform is imminent. It's we can't keep funding healthcare like we are at the moment. We're going to run out of money. It's not sustainable. Something's got to give. There's a lot of backroom antics going on at the moment, especially with an election coming up before May this year. So I think for the future, I think physiotherapy looks very, very bright if we target and be proactive, reactive as well, but more proactive in demonstrating, one, our scope, our economic value, our deliverables to the consumer, our impact on communities. I think if there was a profession that I would want my child to tackle, it would be physiotherapy, because I think we have so much to offer, but also it gives us a lot back in return as well. And that's why I took on this role as national president. Is that physiotherapy has been very, very kind to me. It's been very, very, very good to me, and I wanted to put something back into it. And it's really opened my eyes into how we as a profession really navigate the health system and how we value add to it. If you have a look at different models of care, I think, we won't be having fee for service in 20 years' time. If I have a child now and he graduated or she graduated in, say, 20 years' time, it's not going to be funded like it is today. I think there's going to be block funding. There's going to be a little bit of fee for funding, but there's going to be block funding. There's going to be programs like the GLAD program, like the Sunbeam program, to have some definite input, definite outcomes, and if you follow the program, it works quite well. But also, there's going to be an expanding scope of practice as well within physiotherapy, and it's happening now in women's and men's pelvic health, in disability, in occupational health, in sports, in nearly every sector that we look at. So I think it's not going to be stale. It's going to be really, really looking forwards. And then you put on that long COVID and COVID. You're really looking at a significant shift in how we operate, how we interact with the community, and I think the future looks very, very bright.
Well, it's very exciting to just even think of picturing what the future of physio will look like. And I think there's a lot to be said. You talk about block funding. I think what better, if you're someone that's got a growth mindset, that means that you get better at demonstrating within an X period of time what you can end up doing. Now, I know that there's variables that are involved, but fundamentally, I think that gets us in a more structured way to be able to make sure that we deliver as best value as possible, which I think you've been saying all throughout today. Well, thank you so much. We've been talking to Scott Willis, the president of the APA and owner and physiotherapist at Coastal Physiotherapy. Scott, where can people go to learn more about what it is that you do?
Yeah, from the APA point of view, I'd definitely recommend they get onto the APA website or become a member. It would be even better. Join the 30,724 other members of our profession, which is rising and hitting record numbers every year. So, and also I'm at coastphysio.com.au. That's my business, and down here on the northwest coast of Tasmania.
Perfect. Thank you so much, Scott.
Thank you.